years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. Oh, we're here Tuesday, November 12th already. Wow, halfway through November. So thank you for joining us. We're going to be talking orthopedic surgery and sports medicine today with Dr. Michael Kindya. He is an orthopedic surgeon on staff with Tenet Florida Physician Services. I should say his offices are there. And he's on staff at Florida Medical Center, a campus in North Shore in Fort Lauderdale. You've heard us talk a lot about the hospital, great hospital in Fort Lauderdale. Tenet's only Broward County Hospital, but it is a great hospital. And he now has an office on the campus of West Boca Medical Center in Boca Raton. So that's great to tie into the Boca Raton angle because that's where we're broadcasting from. So without further ado, I want to welcome Dr. Kindya to the program. Dr. Kindya, how are you doing this evening?
I'm doing great, David. Thank you for having me.
Thank you, and I always say thank you for joining us on this adventure of health because we always learn so much. My first question for you is a little bit of a general question. It's a little bit about, I'm going to ask you, I'll go ahead and ask you, what is your medical specialty and how do you help adults, baby boomers, the retired here in South Florida? I think that's mostly, my demographic that listens to this show, so I want to help them out.
So my medical specialty is orthopedics. I also did an extra year of training to specialize in sports medicine, which is basically the treatment of soft tissue injuries related to orthopedics throughout the body. I do a lot of work on knees and on hips. And basically how we keep people active and we keep people in the game is through orthopedics, that people throughout all ages of life experience joint problems, experience pain, and whether it's a fracture, whether it's a tear of a ligament or a tendon, that's how we keep people active and keep people doing what they love to do.
And that's great. We're here in South Florida, so we want to, make sure we get people back to that quality of life, and you have to have a great doctor, to do that, to help you out with whatever ailment you're suffering from. I know I'm one of them. I'm one of those weekend warriors that unfortunately will probably be in your office one day in the future because I like to get it done on the weekend. I like to get out and about. So, but then, athletes as well, just, as we get older, I'm getting a little older. I always share this, you may have an ailment, something may, you may fracture something, break something, stretch something kind of thing. So that's what we're going to talk about. So we're so happy to have you, Dr. Kindya. It's Michael Kindya. So let's get right into it. This is something I can kind of remember from, I didn't have it surgically repaired, but when I was 19 in a game of football, I tore my rotator cuff. Like I said, unfortunately, it happened, but I was able to have a non-surgical approach. But I wanted to ask you, because it's a little different, what is a shoulder arthroscopy and why is it needed? How do you perform? Kind of a three-parter for you.
Sure. So at the most basic level, a shoulder arthroscopy is using a camera to visualize the joint of the shoulder. And it allows us to perform a surgery which used to be performed with much larger incisions by using very small incisions around the shoulder. But also with the new technology in terms of cameras, we're looking through 4K, high definition cameras, and we're getting much better pictures of the joint, and we're seeing much more detail than even the naked eye can see. So through that, we're able to perform a lot of surgeries, such as rotator cuff surgery, debridements of the shoulder, or treating dislocations or other issues of the shoulder that would usually have needed much larger incisions, much more downtime, much more recuperation afterwards.
So that's shoulder arthroscopy. Is there a difference between arthroscopy for the shoulder and arthroplasty, Plasty on the end there?
Yeah, so shoulder arthroplasty is a shoulder replacement surgery. Everyone's familiar with hip replacement and knee replacement, but the third most common joint to have replaced is the shoulder. It's been much more common in Europe, but over the last 10 or 15 years, the number of replacements in the U.S. have gone up dramatically. It's a procedure that I love performing and is great for patients who develop arthritis around the shoulder or develop chronic rotator cuff tears that are unable to be repaired. And we can perform a arthroplasty or a special type of replacement for it that can get people's motion much better and can decrease their pain that they're experiencing.
That's amazing. I learn something new on the show every week. I didn't even know that there were shoulder replacements were a thing, and I'm a PR guy in healthcare, so I got to learn about that to do my PR, but that's great. I mean, I didn't even know that, so that's an option for people who have those chronic shoulder injuries you just explained.
Yeah, chronic shoulder issues, whether it's arthritis, which can be from a number of causes, whether it's a rotator cuff tear that just got ignored for a long period of time, or any other, there's several other reasons to perform it, but those would be the two most common.
Amazing. And we're here with Dr. Michael Kindya, orthopedic surgeon and sports medicine specialist. I'm going to give out his info a ton of times during this program, but let's keep right with it. So we talked about shoulder arthroscopy. We learned about that. So imagine the knee arthroscopy that you do on your areas of interest. Similar type of way you perform the procedure. Obviously, it's for the knee. So when is that needed, and how do you perform that surgery?
So it's a great surgery for people, and we perform it for a number of reasons. The most common reason would be for a tear of the meniscus, which I think everyone has heard of or has had a friend that has had it done. It is the most common orthopedic procedure done in the country. It involves usually 2 or 3 small holes throughout the knee, one for a camera and one for us to work through. And through that, we can deal with a meniscal tear. We can do surgery for mild arthritis. We can also perform ACL and PCL operations through it.
Yeah, that's amazing as well. I was just thinking of something. That's why I was typing just when we were talking. So I was watching this long drive championship last night. And it's golf. It's long drive. So you have the men, and they go, and this guy's ripping it like 312 down the center. And then this woman comes up, and she's, on the come up for, golf, and was a phenom and this and that. And then they're like, she has, both of her meniscus are torn, and she's wearing these braces. And she was nailing it like 300 to 305 down the middle. I couldn't believe it was a torn meniscus. But obviously, over time, that's gonna have to be repaired, right? That MCL?
Generally, if someone's very, very young, that's what we would recommend. When people get a little bit older, sometimes the meniscus tear is not as important because there is some underlying arthritis there. If the arthritis is really bad in someone's knee, probably a replacement operation is better than doing an arthroscopy or a camera operation, but that's very patient dependent.
Yeah, and I thought the same thing, but she was grimacing a little. I think she was going after that win. And, probably had something scheduled and had a great orthopedic surgeon like yourself and was like, all right, yeah, but then after that, we got to get you in. You can't do this forever.
Had some money on the line and then get it done after. It's
she was awesome, though. I was just looking it up when I was talking to you, but I didn't catch it. I'll look during the break, and I'll share her name out there. It's amazing, though, on the women's and men's side. If you ever have a chance to see it, check that out. So we are here with Dr. Michael Kindya. He's an orthopedic surgeon and sports medicine specialist with an office in Fort Lauderdale and Boca Raton. Office in Fort Lauderdale, it's easy. It's right off 95, 2307 West Broward Boulevard, Suite 200 in Fort Lauderdale. Again, 2307 West Broward Boulevard, Suite 200 in Fort Lauderdale. Numbers 954-486-4045. And then also, you said you're in the Boca Raton office on Fridays, is it?
On Mondays.
On Mondays, I'm sorry. Okay. Mondays, Boca Raton office, Dr. Kindya is there, 9970 Central Park Boulevard North, Suite 400A. That's in Boca Raton on the campus of West Boca Medical Center. Beautiful brand new office in the 9970 building that Dr. Michael Kindya shares with some other Tenet Florida Physician Services physicians. The numbers there is 561-430-4610, or you can go to tfpsdocs.com to find Dr. Kindya's profile and some more information. That's tfpsdocs.com. Wow, we already talked about shoulder and knee. I know that's mainly what you do, but you also have some areas of interest that kind of subspecialty off that. One of them is cartilage restoration. And I got to tell you, at first, when I first read this a few years ago, it's not something I was really could care less about. But as I get older, I feel like I'm getting, different feelings. There it is in my knee. I wonder if they heard that ambient sound. But cartilage over time, like, as we're active, it just kind of goes, right? We kind of lose it kind of thing. So you're the guy to talk to about this.
So over the years, a lot of people undergo wear and tear of the cartilage, predominantly in the knees and hips, but also in the shoulders and everywhere throughout the body. It's just a very slow-growing tissue that once it gets damaged, it's almost irreversible for the body to heal it. So what we like to do is when there is certain areas of a joint that have very high grade or a great amount of cartilage loss, then we can perform certain operations in order to grow cartilage back at that area.
Whoa, you're one of those doctors who can grow it out of the body and then insert it back in?
So yes, that's one way of doing it. Another way is transplanting it from one portion of the joint where it's not needed as much to another area where it's needed a little bit more. That's one I did last week, where we took it from a very nice lady's knee and moved it from one area where it's not a weight-bearing area where we can take a little bit of cartilage from, and moved it to an area that's a very weight-bearing area that was a great cause of pain for her.
Wow, I didn't know that either, and that's something I'm interested in because I feel like I would have, cartilage in the area where I don't need it as much and could use it in the place where I do need it.
And we're even lucky now that there are a lot of commercially available products that are from cadavers, where we're able to take cartilage from cadavers and transplant it into, say, a knee or a shoulder.
That's the most amazing thing working with doctors. Like, they're always looking for the next thing, the next best way, the next way that they can offer people a better quality of life. And I've noticed that so much in the last 7 years working with doctors. That's amazing. I didn't know that. That's definitely something I'm interested to. I always localize everything to myself because I'm the one in this seat. Again, we're here with Dr. Michael Kindya. Wow, we're halfway through the show. We're going to take a quick break, and on the other side, we're going to talk about some of the more common tendon, ligament injuries and how Dr. Kindya treats them on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. An informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Show. We're here with Dr. Michael Kindya, orthopedic surgeon, sports medicine specialist with Tenet Florida Physician Services in Fort Lauderdale and Boca Raton, and on staff at Florida Medical Center, a campus in North Shore located in Fort Lauderdale. Dr. Kindya, we talked about this, and boy, were we timely. We talked about this on a podcast, my podcast, about Patrick Mahomes' injury, the patellar dislocation. He's the Kansas City Chiefs quarterback that everyone's watching because he's just an amazing athlete. Were you a little? We thought he was going to bounce back this upcoming weekend and be back, but he kind of surprised everyone, including the whole NFL, and came back. I think it was 3 weeks after his knee was popped back in for a knee dislocation on Monday Night Football on national television. Were you surprised that they let him come back that quick, or were you like...
I'm surprised that he was able to come back that quick. That's a very quick turnaround for an injury like that, but with the training staffs that these teams have, I mean, he's getting treatment every single day, and if it's going to happen, and it was 3 weeks, it's going to happen on an NFL team.
A younger athlete, too, probably, better, setup in the knee, less... trauma over the years to the knee, etc. Yeah, tissues, you mentioned tissues a lot.
Yeah, and there were some reports of him just being a little bit more mobile in terms of his joints than an average person, and that probably helped him get back as well.
Well, we discussed, too, that night when it popped back in, it was such a relief for him. It seemed like his recovery started right that second. Yeah, he was going on the right. And then you said, sometimes, it has to be surgically repaired, but looked like the whole structure was pretty good. So they, the experts there, like you said, were able to give him the clearance. Well, let's talk briefly about, I'm going on a little different path. You worked with a lot of sports teams in your training, and one of your specialties is sports medicine. Talk a little bit about up in Pittsburgh, was it?
Yeah, so I did a year of specialty training in sports medicine in Pittsburgh at Allegheny General Hospital. There we were the team doctors for the Pittsburgh Pirates, and we also got to work with a lot of local colleges as well as high school teams. And we also had the honor of treating the Team USA athletes on the Rugby Sevens team as well.
Wow. That is, Pittsburgh Pirates. Pittsburgh's known for football and the USA Rugby. So definitely got to see a lot of different ailments, huh?
Yeah.
Well, that's
treating high school athletes, college athletes, professional athletes, and even international athletes was a great experience. Getting to see treatments at all levels.
Pittsburgh's a great sports town. I love that town. What a great sports town. Let's get a little bit more back on the clinical side of things. So, what are some of the more common tendon ligament injuries that you kind of hobble into your office or you get called in to see?
So the most common has to be a rotator cuff tendon tear. Very, very common, especially as we age and increase our age, it becomes much more common in the 50s, 60s, and even more so into the 70s and 80s. The other ones that we see very commonly are Achilles injuries, whether it's a tear or a tendonitis or a lot of inflammation around there. We also see a lot of injuries around the knee and around the elbow as well.
I wouldn't have thought rotator cuff would have been number one, but that is interesting. And people, they want to have that fixed as soon as possible. It must be. I remember back in the day, it was annoying. I was 19. Felt like there was a little thing in there. Well, there was a little piece of cartilage in there. But, but people just can't stand that pain, and they just want to get it taken care of, right?
Oh, it's terrible, especially if it's in your dominant arm. It can really change your life. It can change what you can do, what you're comfortable doing. It's a really big issue.
Yeah, range of motion. Wow. I didn't know that. See, I'm learning so many things here. We're here with Dr. Michael Kindya, orthopedic surgeon and sports medicine specialist with Tenet Florida Physician Services. TFPSdocs.com is the website. What are some of the most common fractures that, are in the need of, like an orthopedic surgeon expert like yourself of, evaluating?
So the most common fractures we see are fractures of the hand. They're the most common fractures. And luckily, we can treat most of them without any sort of operation or procedure, just need some immobilization for a short period of time. The more common ones that we see that we do operate on are around the wrist, around the ankle, and especially hip fractures.
Wow, hand again. And orthopedic surgeons, you see everything. It's not, so your areas of interest are in shoulder, knee, etc. But you also see the hand and other parts of the body, right?
Oh, pretty much
Everything?
the entire body: back, shoulders,
Wrist,
knees,
you
hands,
mentioned.
wrists, elbows, you name it. We see it.
Wow. That's good to know, too. Again, it's Dr. Michael Kindya. I'm going to give out his 954 number because they can help with both offices, right?
Correct.
954-486-4045. Tuesday through Friday, he's in Fort Lauderdale, 2307 West Broward Boulevard, Suite 200, Fort Lauderdale, or, Florida Medical Center campus in North Shore, located on Oakland Park Boulevard, right there in Fort Lauderdale Lakes area. And then on Mondays in Boca Raton on the campus of West Boca Medical Center, just go to tfpsdocs.com, type in Dr. Kindya's name. So the D is silent. It's Kindya, and a ton of info there. His areas of interest, his board certification, his education and training fellowship that we talked about. I wanted to get to this one. I'm so glad we had time because arthritis, a lot of questions about it. My grandfather had it really bad. I did find out maybe it can be hereditary because I have had a couple bouts myself. But I wanted to ask you and have an expert orthopedic surgeon on this show because I wanted to ask this question. What is arthritis and why is it a nagging ailment affecting so many people in the second half of life? Like, I feel like I'm 42 now. I feel like it's starting,
So arthritis is the wear and tear of the cartilage that lines our joints. If you've eaten a chicken bone or anything, that white covering over the end of the chicken bone is the cartilage. And as we slowly age through wear and tear, the normal cartilage layer just thins out and thins out and thins out. At its severe form, it's gone, and we basically have bone rubbing on bone, and that's the more severe arthritis or bone-on-bone arthritis that a lot of people talk about. And a lot of people get, whether it's a hip replacement or a knee replacement, that's usually why it's being done.
Yeah, and that's painful when it gets bone-on-bone, right?
Yeah, you lose all the shock absorbers, you lose all the gliding of the joint. It becomes rough surfaces that are ripping against each other. That is very painful.
I've interviewed some orthopedic surgeons on this show in the past, and I feel like I can maybe kind of help to explain this a little bit. So, in my experience, orthopedic surgeons kind of think like engineers in a way. Are you kind of have an engineer in mind? I imagine.
An engineer or a carpenter.
Okay,
yeah.
Carpenter I've heard too. Okay,
Yeah.
Okay. What I'm getting to is so. That cartilage restoration that's needed, the cartilage wears away, or that, arthritis that's needed. We got 2 minutes. Yep. That is needed. That's kind of like the brake pad in my Mustang on the front right side, right? It's going and going, and eventually it's gone, and there's nothing there, and then you have that brake on brake, which is horrible for the rotor, etc. Right?
Yeah, and I like to compare it to a tire on a car where there's a brand new tire, there's a little bit of wear on a tire, and there's a bald tire. And most people are somewhere in that tire being worn place in their life. But once they get to a bald spot, we don't talk about cartilage restoration or anything so much. We talk about getting a new tire or getting a new knee or hip, which is a joint replacement. But all that in between area, we're worried about maybe patching a hole here, doing something like that, tweaking it to make sure that it gets its full life.
Like, think of it like, yeah, you said it perfectly. It's like prevention and maintenance. Mm-hmm. So if someone has an ailment or they know someone who does, and then, they want to get to see you, they have to be referred to you, or you can just call or get an appointment. Do you have to be referred to an orthopedic?
Depending upon your insurance, some people require a referral from their primary care doctor. Most insurances do not, but there are several that do. But if you just call our office, we can let you know which insurance plan you have and what needs to be done, and we can try to get that facilitated for you.
And the number is 954-486-4045. If you have any questions for Dr. Kindya, his staff can answer them. Orthopedic surgery and sports medicine, Fort Lauderdale and Boca Raton. TFPSdocs.com, ton of info there. Wow, we got to my curveball question of the day. What are your hobbies and passions in life outside of medicine? We got a minute.
Well, I like anything to do with water, whether it's fishing, whether it's going to the beach. Like I said, we were talking off the air. I grew up swimming, so anything with the water is great for me. And in the winter, I do love to ski as well, so that involves water.
Yeah. And if you don't mind, New England Patriots fan, he loves his Patriots.
I'm a Boston boy, and I'm a New England sports fan through and through.
Yeah, tough one this weekend, but so does every other NFL team.
Yeah. Well, we're coming off the bye.
Yeah. It'll be a good game.
Yeah.
Well, thank you so much for all the info. A great interview. I'd love to have you on again in the future.
Thank you so much for having me. It was great to be here.
Thank you, and we'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.